Hello, everybody. So before you wonder, this is not a very cool new tracking device. This is actually the transponder of the microphone, which is designed for men wearing suits. So I stopped smoking 1.5 years ago. That was the third time in my life that I stopped smoking. But this time I was very determined to stop for good. And so I thought there must be an app for that. So I looked at the App Store and I downloaded 4 of them, and they all did essentially the same. They asked me how much I smoked. I mean, I didn't smoke much, only 7 cigarettes a day. And so they calculated for me how many cigarettes I have saved already, how much money I've saved, how much nicotine. But most of them were like this, well-meant but not very engaging. So I didn't really bother to look at them again. But then there was this app, Quit. It did essentially the same as the others, but it looked better and it was more playful. So I could get up to a new level, and it always gave me a slight boost when I got informed that I got a success or something like this. But it also essentially counted how much I did not smoke and how much money I saved. And then, after about 5 months, I got informed that I managed not to smoke 1,000 cigarettes. And I thought, wow, I mean, I didn't smoke much at all, and I'm a mathematician. I could have calculated this number by myself, but I didn't. So nothing led me to this idea. And so to see this number, 1,000 cigarettes, was at the same time shocking and motivating to go on. So this was around the same time that activity trackers hit the market in Switzerland, and I asked myself, can actually tracking make me healthier? Just tracking the data, can it make me healthier? And if so, why and how? And I mean, tracking is nothing new. This is what I found in my hotel room tonight. This is a tracking device, very old one, you all know this. And you probably all remember the marks on your door case when you were children that showed how much you had grown. Women track their monthly cycle for ages, and we will see in one of the next talks how this will change with new technology. But the data itself usually doesn't mean a lot. I mean, you have to interpret data, and this is what design does for us. We will see in this talk that design helps us see information in a new way, it motivates us, it can help us make informed decisions. So what do I mean when I talk about design? I usually like the definition of John Maeda, which says design is a way of making meaning in an uncertain world by marrying form with content and content with context. So in other words, design helps us see things. There are many forms of design. So I'm a user experience designer that's also connected with interaction design. Then there are other forms like graphic design, service design, industrial design. No matter which kind of design you take, design can be very powerful. So you can manipulate people by displaying information in a certain way. You can even spike up sales by millions of dollars with the change of one button. I mean, this very rarely happens, but it happens, so I can tell you the story later if you're interested. It was not my button, unfortunately, but... So, actually, given this, knowing the power of design, we still asked ourselves, yeah, but why does tracking actually work? So, to understand this, let's have a look at the actual causes of death. That was a study that was conducted in the 1990s in the US. So researchers looked at the external modifiable factors, not the genetic diseases, but the external modifiable factors that lead to premature death. And they found out that the number one external factor is tobacco, followed by number 2, a poor diet, and number 3, physical inactivity. So this was in 1993. Perhaps lifestyle changed in between. So they repeated the study in 2000. And actually they had the same results, only that tobacco was a bit closer to poor diet, and perhaps poor diet will overtake tobacco in the future. But still, I mean, these are the main causes why people become sick and die prematurely. So knowing this, that these are the actual causes of death, then you could also say that lifestyle is the new medicine. I mean, our healthcare system right now is really reactive. So I go to a doctor when I have a problem. And the mindset is often this of a garage. I mean, I go there, I get myself repaired, I hope the doctor has the right spare parts for me, then I go home and live my life as before. But this is changing right now. We are going to a more preventive healthcare system. And this is on the one hand due to the internet. I mean, there is not this knowledge monopoly that the doctor has anymore, so the patient can inform himself and he comes to the doctor with all the data. And of course, this is also a social necessity. So healthcare is becoming more preventive, and in some branches of healthcare, it's very common for years, for instance, in dentistry. I mean, we brush and we floss and we go to dental hygiene. And when we go to a dentist, it's often only to find out that everything is all right. So when lifestyle is a new medicine, then actually we could view these activity trackers as the pioneers of this new preventive healthcare system. I mean, they promise exactly this, to make you healthier by changing to a healthier lifestyle. So you probably know of the success of these activity trackers. They measure your steps and your sleep, and I saw many of them using them. So who's actually using one? Fitbit, Jawbone, Withings? So yeah, a few hands are going up. And I mean, there are more every week. I mean, this is a new Microsoft Band and soon coming the Apple Watch. And they all promise the self that they make you healthier by helping you changing your behavior. So, I mean, this could actually work. I mean, when we think that lifestyle is a new medicine, then actually the walk during lunch break could be the new blood pressure pill. And taking this further, actually you should get a tracker on prescription, shouldn't you? So how do these trackers actually work? So I mean, you have to set it up, you measure something, you display the data, you have to interpret data, and then you have to support, somehow you have to support action. And so last year, when the trackers went mainstream in Switzerland, we asked ourselves, we didn't find any doctor who prescribed trackers, but in the internet we found a lot of self-reports by very tech-savvy persons, but we didn't find reports by normal persons who just try to live healthier. So we asked ourselves, is this possible? Can you just give a normal person next door who never intended to buy a tracker, such an activity tracker, and would he live healthier? So we recruited 10 people, aged 19 till 71, and we were just then realizing how popular those trackers were last September, because they were sold out in several shops, so we had to look around to find them. Then we equipped them with these trackers, and then we showed how they did. So the first thing at setup, it was already difficult. There was with every brand, we bought Fitbit, Jawbone, and Withings. With every brand, there were problems, and there were people who probably would have just thrown it in the corner and never used it because they simply couldn't set it up. So when you are not that tech savvy, it's kind of difficult sometimes. But what was then surprisingly easy was measuring. So everyone was wearing the tracker night and day, and there was no problem, and it's becoming easier every day. I mean, you can track almost everything. Every day, actually, is coming out a new tracker where you can track something, and this is not the problem. But then it becomes more difficult. You have to interpret the data. And let's have a look, for instance, how can you interpret sleep data? I mean, sleep data are recorded usually at the wristband, and it measures how your arm moves during the night. And at all the apps we looked, they distinguished between light sleep and deep sleep, and they displayed it in different ways. For instance, here, this is Jawbone. The light sleep is the light blue bar, which is lower than the deep sleep, the dark blue bar. So Withing does it the other way around. Deep sleep is deep, and light sleep is the larger bar, and Fitbit, they have all the same height. So you see, there is no standard. So, and how innovative and what a design challenge actually the displaying of medical data is, we can perhaps illustrate in this project. This is a very interesting project by the Department of Veteran Affairs, and they want to make the patient the owner of their data. So they have the blue button campaign, which says, go to our website when you are a veteran of the US, press the blue button and then download your medical data. This is really great. This is what we would wish for in many hospitals. And so they made it reality, but when you press the blue button, you get your data. It looks like this. And soon they, of course, saw that this is not really, this is probably very well machine readable, but for a human being it's a bit difficult usually. And so the initiators of the campaign realized this and set up the Health Design Challenge. And so they have had the curators from industry, from government, from design innovators, and actually, they got a lot of, in this challenge, they got a lot of response. 230 designers responded with a design for Alan Ross. And there was a variety of great, innovative ideas how to display medical information. So there's a lot going on in the design community. So then when you display the data, you have to interpret them. And I would like to show this at this example. This is actually a device our energy provider gave to us, and it measures how much warm water I use when I'm showering. And in the beginning, there is this polar bear on an ice sheet, and when I shower longer, the ice sheet gets smaller, and when I shower very long, the ice sheet is gone and the polar bear drowned. I thought that was a nice gimmick, but for my son it was very serious. He didn't want to shower at all anymore. He didn't want to harm the polar bear. And so I really had a hard time to convince him that it's okay to shower once in a while and that he won't harm the polar bear. What you see at this example is that design can be very powerful. Interpretation of data can be very powerful. It can even make the data emotional. And of course, you can manipulate people, and you can do this for the good or for the bad. So it's really important how you display data. So one important thing is actually not to scare people. That is easily done with medical data. We had people also in our tests that thought that read the average data. For instance, the average is when people sleep 7 hours. I only sleep 6. So I have to worry, and so it's very critical to interpret data with average values or critical values. On the other hand, you also don't want people to have false security. So it's really, you really have to think a lot how to display this in a good way. For instance, I have this app, Cardio. This is an app where you can put your finger on your camera and it measures your heart rate, and it's surprisingly accurate, I have to say. But then it asked me some days ago, upgrade to find how long you may live based on your average resting heart rate. No, I really don't want this. How can they even suggest that they can tell me how long I will live just on my resting heart rate? So, you shouldn't do this. And the other thing you shouldn't do is just put the people in, just add to this constant flow of information people have anyway. You have to help them to see what is relevant, to see where they should react to, but you shouldn't show them all your data you measures because they are not interesting at all. So really try to support people in just seeing this information that they really need. Okay, now you measured it, you displayed it, you interpreted it well, and then you have to change the behavior of people. And this is a whole another story, because now people know what they should do, but they don't. We all know that smoking is bad, but still a lot of people smoke. Not me anymore. But you shouldn't eat so much chocolate or something like this, but it's difficult from knowledge to change really your behavior. So with the trackers, we saw that people were really wearing them, and also after the study ended, they were still wearing them night and day, and they really liked it. And when we asked them, did you change your behavior? They said, no. It's interesting to look at the data, but no, I didn't change my behavior. And later in the interview, it came out that, they get out of the streetcar 2 stations earlier to walk a bit. And when we asked, and this has nothing to do with the tracker? No, I wanted to do this anyway. So it was that they changed something, obviously, but they didn't attribute it to the tracker. They expected from the tracker, they expected more like a big bang, that their whole behavior would turn different, and these baby steps they didn't really acknowledge. And this is probably something you can also support by design, that you really tell them it's going to be in baby steps, but you can value each step actually. So what can we do to make people change their behavior? We could give them electric shocks. I mean, this is really a device funded on Indiegogo lately, so many people seem to want this. You can buy it soon. But it was actually initiated by a guy who increased his productivity by 4 by hiring a woman that slapped him in the face every time he went on Facebook. So that, that might not work for everybody. I mean, it wouldn't work for me. I more like positive reinforcement, so apps like this that look like a spa already. This is an app made by the makers of Runkeeper. Probably many of you know Runkeeper. And in this app, you see that they really learned a lot about how people behave, how people walk, how people track. And this is counting your steps. And it's setting you a daily goal, and it's, for instance, dependent on the day. So when they know I go running on Sunday, my goal will be higher than on a Monday. And then they have this tiny tab here, which moves during the day, so that you always see if you are ahead or behind your goal, and it moves faster during midday when you usually walk during lunch break. So they do a lot of things right. And what I liked a lot was, even on a day, obviously it's 11:45 at night, and I only reached 25% of my goal. And so I'm not going to reach it today, but they still tell me, oh, and you are awesome. Yeah, so I like this more than the electroshocks. And then, of course, there are the gamers. And I mean, we will also hear more about this in the next talk, how apps can motivate people by gamification. This is one quite successful app. It's a runner's app as well, Zombies Run. So you go running, and then you put in your earphones, and then you are on a mission to save the world from zombies. And you get your audio clues to run faster because you are followed by a horde of zombies, or because you have to rescue someone next block or something like this. And it really resonates with a lot of people. 800,000 users are using this app already. So what you see at these examples is that motivation is deeply personal. There will not be the one app that fits everybody and all purposes. So, and I even met people who would never use Imagine. I met people who would probably never use an app for motivation, but we can't do anything for them probably, but for all others, there might be an app that they can use to get motivation. But of course, you really have to understand the context of the users and support the action. And that's where all the positive examples here. So, but now you still can get sick, of course, and then you take all the data and your nice apps, and then you go to a doctor and you enter this world. And this is really like in 2014, it looks in many hospitals. And yeah, so how does this come together? It's really not only bad looking. I mean, it's not that bad when it don't has to be nice, but it's really not very well usable, those systems, and they indeed kill people. I mean, there's a study about the role of computerized physician order entry systems, and they are supposed to make healthcare more safe, and they probably do compared to paper, but still you can make a lot of errors with those systems when they are not well designed. And they pointed out all the errors you can make here, and it's mainly usability errors. So it's really serious, and so we have to do something about. So, but when you now go to a doctor and say, we have to give you new technology and it will make your life better, then he will probably say, no, I don't need more technology. I'm anyway spending so much time on a computer and not so much with the patient, and he won't like this, perhaps. And but of course, this cannot be stopped. I mean, consumerization is taking over. The patients are coming with their apps, and apps like Apple Health, which is not really an app but an infrastructure. They will help to exchange secure data between patient and hospital. For instance, there are hospitals who have apps already or who are working on apps. Then still there's a problem how to display it, because this is what the user sees, but the sleep researcher wants to see more data like this probably. But still, when you fixed all this, when you have the secure data exchange, then the patient and the doctor together, they have to make meaning from what the data mean. I mean, when I track my stomach pain and I can tell the doctor, I'm every morning at 9 when I enter the office, I get a stomach pain, then we have to find out together, is this because I'm afraid of my boss, or is it perhaps because the latte I drink before and I have a lactose intolerance? And so this is how doctor and patient only together they can find the story behind it. So the patient will become an expert of his own health more and more. So coming back to our initial question, can self-tracking make me healthier? Yes, it can, but only when we understand the context and design the experience very carefully. So the technology is there already. We don't only have to design the services, and we have to find the stories behind the data, and I hope we can do this together in the next years. So it's really a very exciting topic, I think. Thank you.